So it is Black maternal health. And before y'all start showing y'all true colors, talking about, well, why we always gotta talk about it being Black this, Black that, there would be no need to talk about Black maternal health if we had care for mothers of all colors and of all backgrounds, right? The single mothers, Black mothers, all different kinds of mothers. The reason why we have Black maternal health is because Black women are susceptible to go into the hospital and not make it out. They're susceptible to more racial biases in the medical field. This has been going on for years. This is not my first time telling my story. I've shared the story. I've written blogs on it. I share the story almost every year, and I feel like it's something that needs to be shared. I have three beautiful children. Two out of the three of the births that I had almost cost me my life. My first child was 6 weeks early, and I went into preeclampsia. And in the midst of going through preeclampsia, my blood pressure was going so dangerously high that my mother literally had to advocate for me. That means she had to raise the alarm and scream and shout for them to do what they needed to do so that I could be out of harm's way. My last and final child, my daughter, I had a blood clot in my brain. I was a high risk from the beginning. This blood clot that I had in my brain came about because I was pregnant. This was pregnancy caused. So they knew that I was high risk. When I went into the delivery room, they literally had a team of people there to do all the things. I had to give myself shots 2 times a day so that I would not bleed out. They had to time the surgery so that I could get the surgery, close me up so that I could prevent, again, bleeding out. I ended up having these blood clots that came out of my body. They were almost the size, felt like the size of a baby. They were majorly big. I went back into the hospital because my son, out of being a 2-year-old, was so happy to see me that he jumped on my stomach, caused me to go back into the hospital. But I'm still under this care because this blood clot that I had in my brain didn't just go away, and now I'm having internal bleeding. And I remember very specifically the two techs that were supposed to be doing an ultrasound, or I believe a CAT scan. They were like, well, I don't understand why she couldn't just walk from the gurney to get to the CAT scan machine. I had lost all color in my skin. I was in extreme amounts of pain. And because they just assumed that, one, my pain tolerance was high and that I should be able to just simply take it, that at the end of the day, why didn't I just do? It took my husband having a friend on standby, which is our mutual friend, who was a doctor, for her to tell him the words to say that probably ended up saving my life to this day. I wasn't even supposed to be here. The reason why if you're mad about having Black Maternal Health Week, what you need to be more curious about is how can you lend your voice so that we don't have to have these conversations. We don't want to go into the hospital and think about the fact that we may not come home. We don't want to have our children to think, my God, should be as simple. We have all this technology, we have all this understanding and knowledge, but we're still having Black women go home and not being heard. We still have women dying in delivery. There are certain movies that talk about this subject that to this day I cannot watch. There are conversations that as we continue to have them, they are troubling, they are triggering to me because I know the life that I could not be here today, that my children could be without a mother, all because of the medical bias that does and still prevalently exists to this day. We have seen recent videos and everybody's in an uproar because they look recent. And although those videos are traumatizing to watch, they're very real, but they are the explanation of many women who don't have platforms like me that they're not able to tell their story. So if you're mad about Black Maternal Health Week, I need you to be more mad about the fact that we have medical biases that continue to happen. Be more mad about that. I don't care what color you are. Don't care if you have a child or not. I think we all need to raise the alarm. We need to all raise our voice so that every mother can go home. There's no reason for us to be losing mothers like we do in the United States, and specifically towards Black women in the alarming rates that we do. Not in this country where we have all this technology. We now have AI and we still can't get it right. So people are using their voices to speak up so that more people can hear that this is very real. Number two, providing resources. I'm going to do everything I can to provide as many resources. So look at all the links and follow everything through, because it's important for you to have enough resources so that you can make informed decisions. And I wish I would have known about having midwives, because I felt like that was something that was outside of my range, like I couldn't get it. And it's the crazy part is that we need more midwives. We need more midwives that look like the women like myself, because we go into these different medical fields. We go into these hospitals and these doctors' offices, and because people don't look like us, they don't understand what we're trying to say. They assume that we just want drugs, or they assume that we're just saying that we don't get it. They've been doing this for years, and so we're just complaining, and it's invalid. It couldn't be further from the truth. So to every woman, to every family that is unfortunately dealing with the crisis that they unfortunately had a loved one that didn't come home from the hospital, my heart goes out to you, because I could be right in that same number. I'm grateful for my mother who advocated for me. I'm grateful for that doctor friend who advocated for me. You know who you are. I'm not going to call you out by name. I'm grateful for my husband who stood in the gap to do whatever he could to make sure that our kids had both parents. So if you're more upset about Black maternal health, be more upset that the fact that we even need it in the first place.